So first I would like to invite Professor Dr. Rajiv Kumar Gupta sir. He's a professor and HOD at RIU-RIMS Ranchi, and he's going to give an overview of postgraduate training in ophthalmology.
Good afternoon, everyone, chairpersons, dignitaries present in the dais hall. Basically, this program is based for the postgraduate student and the training institute. The session is on teaching and evaluation of postgraduate resident, a pragmatic approach. And my topic is postgraduate training in ophthalmology in India, an overview. As you all know, the entire institution of medicine, like the institution of education, is widely seen as a public good. Medical education is therefore doubly burdened with noble responsibility. It bears this responsibility to educate well and wisely to both the student and to students' future patients whose very life might depend on it. So, to safeguard against dilution of standards, the criteria for imparting a medical education have always been stricter and more demanding than other streams. The training of postgraduate student is very critical, not only for providing quality eye care to the population, but also for the future of Indian ophthalmology. A good and proper training is required to make resident a competent ophthalmologist who could tackle ophthalmic problems independently and play an important role in elimination of blindness. There has been a definite drop in the standard of medical education in India, with only half a dozen medical institutes considered to be center of excellence, and even fewer central institutions where the infrastructure is adequate. This is an article on evaluation of Medical College Department of Ophthalmology in India and change following provision of modern instrumentation and training. Now, what is the current status and postgraduate training in India? Postgraduate residency program is started by taking admission in a postgraduate course either in a government medical college or a private medical college or a National Board of Examiners NBE accredited hospital. The admission is done yearly through a common entrance examination, National Eligibility Entrance Test, that is NEET, and the seat is allotted on merit cum choice basis. Duration of the course is in government and private medical college, 2 courses run, MS Ophthalmology and Diploma Ophthalmology. MS 3-year duration and Diploma 2 years duration. In NBE accredited hospital, 2 courses run, primary DNB and secondary DNB, while primary DNB is 3-year duration, secondary DNB is 2 years duration. Now, the total number of available seats, postgraduate seats in India are, in government medical college, it is 936, in private medical college, it is 509, and in NB accredited hospital, it is 205. National Medical Commission and the National Board of Examination, NBE, are the regulatory authorities responsible for setting the standard for postgraduate medical education. All training institutes, with the exception of some central autonomous institutes, which are deemed universities, need an affiliation with a university for the conduct of the certifying examination for the award of postgraduate degree. NMC is responsible for conduct of NMC and DA examination, while National Board of Examination, NB, is responsible for the conduct of primary and secondary DMB examination. Medical Assessment and Rating Board is one of the wing of NMC certifying the availability of adequate infrastructure, clinical materials, and trained workforce in the training institute. Presently, postgraduate medical education is governed by MCI Postgraduate Medical Education Regulation 2000, which has the goal of producing competent ophthalmologists. So what should be the aim of postgraduate training? It should be to produce competent ophthalmologists who can independently and ethically deal with the patients in an appropriate manner. Training model should include enhancing the academic skills, giving them theoretical knowledge by lectures, either in-house faculties or guest faculties, seminars, case presentation, journal clubs, good library containing books and journals, both national and international. Clinical skill, they should be trained to do a comprehensive ocular examination with modern ophthalmic instrument, including refraction, whether passive or active, torchlight examination, slit lamp examination, applanation tonometer, gonioscopy, direct and indirect ophthalmoscopy, slit lamp microscopy. They should also be able to perform and interpret routine ophthalmical investigations, keratometry, ultrasonography, automated perimetry, optical coherence tomography, fundus photography, specular microscopy, central corneal thickness measurement, and corneal topography. Regarding surgical skill, they should be able to perform independently minor procedures and surgery like SICS, phacoemulsification, sac surgery, and trabeculotomy. To assist in squint surgery, posterior segment surgery, and keratoplasty. This is also a very important aspect of the training, that is developing research skill. Every postgraduate student at training should take up a research project. They have to write thesis. They have to present research paper or poster at conferences, whether it is state, regional, national, or international. They should publish article in journals. The present scenario, it is really intriguing to observe that after completion of residency program, a substantial number of students do fellowship program for variable periods, ranging from 3 months to 3 years. So what are the questions to be considered? Are the fresh postgraduate students not well trained and lack confidence in working outside and setting of medical college hospital? What are the challenges encountered in proper training of the residents? What is the USP of institute that offer fellowship training that attract fresh postgraduate students after completion of residency program? The challenges encountered are inadequate infrastructure. It has been observed that in majority of the training institute, the infrastructure development has not kept pace with the changing times. Absence of a standard curriculum. No standard curriculum is prescribed either by NMC or NBE for training resident, resulting in variable competencies. Deficiency of faculty and trainer who are not updating themselves in day-to-day advancement in modern-day ophthalmology. Non-availability or the non-functioning of instrument or equipment for investigation and surgery in majority of the institutes. Lack of training in various subspecialties of ophthalmology. Lack of proper and informed evaluation. There is no provision to test the quality of the training and the trainers by regulatory authorities. There is lack of opportunity. Training program of the resident is not defined and informed, so is dependent upon the faculty, especially the head of the department. Indifference of the student to learn. The aim of the present instruction course is that this course has been specifically designed with the aim to discuss the challenges encountered during postgraduate training, both for the trainer and the trainee, and the method needed to overcome these in the best possible and